There's an enormous amount of data that we can act on empirically to help people lead a better life by changing the light and energetic environment that they're in. And that's the thing that people need to most appreciate about light. There is no aspect of their physiology that it does not touch.
It's the one signal that every living thing has had for millennia to be able to entrain their bodies to be able to teach their bodies when to perform certain functions. It's not realistic to tell a cell that it has to do all tasks all the time. And instead, we get code that comes from the light frequencies in our environment, depending on the time of day, depending on the time of year, that help our cells determine exactly what needs to be done any given moment of any given day.
How much time are you spending outside? Do you see the sunrise? How much time do you spend in front of screens? When are you looking at screens? Do you have blue blocking glasses? And if so, what brand? How often do you wear them? So people are like, why do you ask all these questions about light? And then I tell them, like, light is fundamental. If you don't get your light right, you're not going to get your health right.
And so stress means a lot of different things to different people. But I can tell you, in my opinion, the number one stress that we face in our modern world is the abnormal light environment that we actually put ourselves into every day. We were designed for a solar light environment. And that is so clear. The evidence is, in my opinion, inarguable at this point, and we're making ourselves sick simply with our modern technology and our indoor lifestyle. And if we don't understand that, then you really have no explanation for the epidemic of chronic disease.
What's going on in healthcare right now? Our patients are being destroyed in chronic disease epidemics that we should be able to fix, but we can't.
And that's why we're living through an epidemic of depression, anxiety, low thyroid hormone levels, women who have really horrific symptoms of menopause. All these people with all these hormonal abnormalities, invariably when you talk to them about their lighting environment, there is something that can be fixed, and sometimes that something gives them a tremendous therapeutic benefit that cannot be had with some kind of pill.
Then maybe you start to go, have we missed something? Have we missed something kind of big? And have we missed it because the algorithms that we were subject to, meaning education and curriculum, somehow never taught us about the physics of sunlight?
And just the results that I saw with myself, with my patients, with my family, totally changed the way I practiced medicine. And I left behind an enormous amount of stuff that I realized was incomplete, inadequate, and simply inferior to dealing with people's lighting and electromagnetic environments.